Are you thinking of becoming an opioid deprescribing superhero? In this video, discover how you can evaluate the benefits and harms, engage patients, offer practical and effective alternatives, and start individualized tapering plans. First, let's look at the benefits. For persistent non-cancer pain, there is very little evidence that long-term opioids provide meaningful benefits. Compared to placebo, opioids don't reliably improve pain or physical or emotional function, and beyond 6 months, effectiveness is largely unknown. What is known? The harms. Opioid use increases the risk of all-cause mortality, hospitalisation and ambulance attendances, serious falls and fractures, low testosterone level and sexual dysfunction in men, plus a long list of other adverse effects. For most people, the harms clearly outweigh the benefits, and yet opioid use for persistent non-cancer pain remains high. So, how do I engage patients? Start by finding out what matters to them. Shift the conversation from pain scores to function. What activities matter most? What happens to their function when a dose is delayed or missed, often less than expected? Could opioid adverse effects be limiting their function or quality of life more than the pain? Here's the reassuring part for you and your patient. When opioids are reduced or stopped, many people report little change in pain, and often the same or even improved function and quality of life. Support the deprescribing conversation with an Empower brochure and offer evidence-based alternatives like a structured exercise program, self-management strategies, specialist pain care or pain clinics, and cognitive behavioural therapy. Set realistic expectations. No single treatment removes all pain, but these approaches can significantly improve function and overall quality of life. If your patients remain unsure about deprescribing, reassure them you can pause, slow down, or adjust the taper, or restart their medicine later if they need to. This is a trial, not a point of no return. Opioids can be particularly tricky and may need to be tapered over months, and that's okay. Once your patient is ready, develop a tapering plan together that is aligned with their goals and preferences. Provide your patients with an individualized, written tapering plan. Monitor regularly, check in about withdrawal symptoms, and adjust as needed. Don't settle for the status quo. Don't automatically renew or continue these medicines without review. Join the Deprescribing Superhero League today. Health professionals using evidence, empathy, and practical tools to improve patient outcomes. For more support with medication deprescribing, explore the Support Meds website and resources.